All right, welcome to our next session, Eyes on Dry Eye 2024. Excited to be joined by two colleagues that are passionate about treating patients with ocular surface disease in their practices, two different unique practices. Discover and feel the difference. We're going to be talking about E-SWIN technology. They have both a diagnostic called Tearcheck and a treatment option called EI, which is IRPL. And I'd like to welcome Dr. Anna Ross and Dr. Michael Moorehead. Welcome to Eyes on Dry Eye. How are you guys doing today?
Doing great. Thank you very much.
Thank you.
So, Dr. Ross, why don't you get started? Tell us a little bit about your practice, who you are, and maybe why you got interested in treating dry eye in your practice.
Sure. I've been working in cornea for a long time. I was working in a refractive surgery center, and then I worked at a cornea transplant center in New York City at New York Eye and Ear for a long time. And then I came up to the Bronx and started working with an ophthalmologist up there, and we specialize in anterior segment disease. I would say I really started to get passionate about dry eye when I started to learn that there was more that we could do for our patients than what we were doing. And I started to really attend some conferences and really see what's out there to help our patients more than we've been helping our patients. And I found that really exciting. So that's how I got my start in dry eye.
Mike, tell us a little bit about your practice and how you became interested in providing more dry eye services to patients in your practice.
Well, it was, first of all, very prevalent in my patient population. And in that population, I found myself kind of lacking either the skills or knowledge or ability to produce positive outcomes. And I started looking at opportunities to learn more about it, and attended Dr. Ross did a couple conferences, got more knowledgeable, found out about some of the new treatments, and became interested in possibly delving into that myself.
Okay. So we'll continue, Mike. How did you first hear about E-SWIN USA?
At Dry Eye University, the reps were there. A lot of representatives were there. One of the reps was Michelle Schnabel, who was with E-SWIN at the time, and just began talking to them. But I think also I was highly recommended by one of the speakers at Dry Eye University. Just they stated some features that seemed positive and maybe possibly advantageous compared to some of the other systems out there. And as I talked to them more about it, it seemed like the way to go.
I had the same question. How did you first hear about E-SWIN?
I have a similar story to Mike. I wonder if I met him at Dry Eye University. I was there last year and was also listening carefully to the presentations from the doctors, and I noticed that some of them had more than one company's instrument. And so I did talk to them after privately, try to get a sense of like, which one do you like more? Which one's giving better outcomes? Which one's, which one would you recommend if you were me, kind of situation. And I started to get really positive response about E-SWIN. Michelle was there. I got to see one and look at one right there on the floor. So I got to demo that, which was great. And that was how I first got interested in it.
So jumping back to Mike, it sounds like both of you guys were perhaps at the same Dry Eye University.
Sounds like it.
Looking back prior to bringing in E-SWIN technology, what was the setup in your practice in terms of looking at diagnosing dry eye and treating dry eye? Did you have these things in place prior to bringing in E-SWIN technology?
I really didn't have anything in place at the time. It was more how I'd just been kind of managing dry eye with eye drops, with lid scrubs, with warm compresses, with the basic supplemental type care therapies. But patients weren't getting much better. And I was frustrated with that. looking for options, and that's what got me curious to attend Dry Eye University and get some more advice and training.
So kind of seeing that need in your practice, doing the traditional, what we would call level 1 therapy with OTC products, looking at different supplements, et cetera, to be able to help patients, warm compresses, lid scrubs, but not really having something more definitive to both identify the patient and to treat that patient. Anna, how did things look in the Bronx prior to bringing in E-SWIN technology?
Well, similarly, we were also treating with those tier 1 treatments. And also our patients, we have a very busy schedule, and the patients have a lot of disease, and dry eye is one of their diseases. There's a lot of things to treat, right? Glaucoma, diabetes, there's a lot of things going on in that practice. And we didn't have more to offer them than what we had been doing, right? So we were diagnostically checking with fluorescein strips, Shermers, advising hot compresses, Zydris, Cequa, Restasis, that whole tier of treatment. I did leave Dry Eye University with a BluffX, which was helpful for treating lids, but I really wanted to offer more. But until we had Tearcheck and EI, we didn't have more in place.
So OD-AMD practice, solo OD practice, different part of the country, but similar patients, similar needs to bring in something more. So I know we're going to talk both about the diagnostics and the treatment, but I want to focus on the diagnostic side, because it seems like in both of your practices, that was definitely something that was missing, kind of doing the traditional, fluorescein staining, lissamine staining, Shermers you mentioned, tear breakup time, those sorts of things. But let's talk about E-SWIN's diagnostic solution, which is the Tearcheck. And Mike, what exactly is the Tearcheck? What are the features that you find most compelling, and how are you using that in your practice?
We use it on practically every patient to screen them. We do the non-invasive breakup time, which is also part of the tear film stability evaluation. We do mybography, and then a questionnaire, usually the speed questionnaire, which is not part of the Tearcheck, but Tearcheck does have an eye fitness test, which we use later. So we screen them, I would say, and then I evaluate them with my Meibomian gland evaluator. And then we present those findings to them. And I would say the most compelling thing for the patients is the mybography, being able to see those glands and educate them about how that fits into their symptomatology, and the other findings is really, really helpful. Also, non-invasive breakup time is very helpful. I find that to be quite useful both in diagnosing and in following the treatment.
And Anna, when you think about Tearcheck and all the things that you're doing in your patient base with complex corneal disease, glaucoma, retina issues, is how do you integrate Tearcheck into an OD-AMD practice?
We're also screening patients, doing a couple of those tests. Mybography, which I agree with Mike, is really valuable, and I think it's probably my favorite test of all of them. But I like the camera that shows Demodex. That's really good too. You can get really high magnification and really show the patient the lids, and the redness, the ocular inflammation. Like, there are different tests on there that are really helpful. So we try to do just a few to see, especially on patients who we know we've been treating for dry eye for a long time, and we know they're coming back in. What we've been doing is scheduling separate exams for ocular surface disease exams, and doing all of those tests when they come in for that. But when they're just coming in for their regular checkups, we're just doing a couple of the tests. Mybography is one of them.
Got it. So it sounds like Tearcheck is pretty versatile in being able to do both screenings, with a couple of tests, and I assume you can just simply choose whatever tests you want to be part of that screening, and then also have them have a battery of tests to get a baseline and also to track the patient over time. You know, that's one part of what E-SWIN offers in their bundle solution. The other part is obviously treatment, and the things that you've been offering for treatment historically sound like what most of our colleagues do. But I think once we start identifying these patients, we obviously have to have a better solution or an additional solution that's going to be able to get after the root cause in some of our patients, which is inflammatory lid disease. So Anna, you know, thinking about EI and the IRPL, what you said that you spoke with some folks at the conference that had multiple technologies and they kind of favored the EI solution. Were there other things that influenced your decision to make that purchase?
Yeah, there were a number of things. I also got a list of doctors who'd bought the EI from Michelle and called a number of them around the country to find out what their experience has been like, what their results have been like, what I kind of interviewed them with my list of questions. And I got so many positive comments. It became obvious that nobody regretted buying it, and it was really everyone was happy with their results and purchase with it. And also there were a number of other things that mattered to me too. The EI package comes with consumables included. The warranty is really good. I felt like the service was going to be good, and I'd heard the service was good, that if you had a question, if you had a patient and you needed some advice about something, or you needed a question about the instrument, that I would be able to get somebody on the phone. I would be able to get support. That mattered to me too. And then lastly, it was portable. The device was going to, it comes with a suitcase that you can, with wheels, and you can pack it up and bring it to another office if you want to. All of these things meant a lot to me and influenced my decision.
So portability, support at the time of the purchase, support afterwards, which I think is pretty critical. And then I think results that you've heard from other peers throughout the country. Mike, anything to add to that in terms of your decision to purchase not only Tearcheck, but the treatment solution with EI, IRPL?
Well, I think actually probably the reason I decided to purchase, one of the reasons was the recommendation of one of the speakers at Dry Eye University. I think Dr. Darabandi uses it, and the fact that it seemed to be more comfortable in people's opinions than some of the other technologies, less of a rubber band type sting effect, which I've found to be the case. It's very comfortable. Patients have no objection to the feel of the technology. I think also the highly a real strong recommendation from, or strong service in the fact that we had somebody coming in to train us on the instrument was a big part of my decision, because I needed that. I needed somebody who had the experience, and E-SWIN provided that person in Michelle, and she was great. And she did an excellent job training us, and I think that was a huge part of our getting into it, getting going with it, and being successful with it.
So it sounds like a really positive experience when they came in to train you and your staff as to how to implement both the diagnostic and treatment solution. What was your experience like, Anna, with that initial installation, training, and implementation? What were they able to do to help your practice?
Everything. They retrained our staff. I mean, we went from not having a dedicated dry eye exam or protocol to now having one. And also the training of the staff, how to talk to patients about IPL and dry eye, giving them some words for explaining things, training the whole staff on the whole process. I feel like kind of evolved the practice. So it was more than just buying the IPL and buying the Tearcheck, it was this rethinking about how we think as a practice about dry eye. And we even got the patients to buy in, but they're filling out forms and we're getting them to think about their dry eye symptoms and when they're bothered. And, you know, the questions we were asking them is different than what we used to ask. So I feel like it was a really big deal. Like it was a really big change in our practice and a really positive one.
That's great. So it sounds like, just like we see with any technology, it doesn't matter how great the technology is. If you can't get your team excited about it, you can't implement that into a busy practice, well, then it doesn't do anybody any good. So let's pivot now to results with the technology. And maybe let's focus on the IRPL, the EI in particular. Mike, have you been pretty satisfied with what you're seeing from a clinical results? What are you telling a patient as far as what to expect, and what are you seeing after someone's gone through a treatment course?
I don't talk a lot about what to expect. I focus on the findings that indicate they've got a problem. I talk to them about how it's a chronic progressive condition that if it's not dealt with and treated, it will get worse. I tell them that I'm a good example of that because I wasn't treating myself in the proper way when I was, 10, 20 years ago when I could have used this technology. And I tell them about my own personal experience with it, which has been very positive. And then as I've adopted the technology and I've had it for 5-6 months now, I'm beginning to see that the majority of patients, it just works. Patients are more comfortable. Their tear film is more stable. They're telling me about how their eyes are feeling better. It's just something I found that works. And it's great to hear the success and see the improvement in people's eyes. It's not 100%. I will say that. I have some people who, at this point, some of them haven't. I've only finished treatment on maybe a dozen or so out of the group that I've got going. So I've got a lot more results coming along, but I would say easily 80% get positive results, probably more higher than that, actually.
Great. Anna, what do you think has been the biggest benefit of the technology so far in your practice?
Offering the patients another way to treat their dry eye that gets to the root cause of the dry eye and isn't just a Band-Aid with tears. And I think that they really appreciate having the option to do a more innovative procedure. I would say I also educate them that part of our goal is to keep them from getting any worse. And we have those patients in our practice who are severe dry eye. Maybe they've been dry for 30 years. They've never had anything besides tears or restasis. And some of them are in really bad shape. And I try to tell them, like, this is what it looked like when you do nothing. And when you're, this is what we could do to prevent you from progressing along this path. I also try not to make it sound like this is a cure. This is not, and it's adjunctive. So I don't want them to stop the other treatments. I want them to, we're doing more than one thing at the same time, but this is going to be part of the process. And I think it's been really positive for the practice. I would say, similar to Mike, most of the patients have been really happy and glad that they've done it. And I've seen improvements in their tear film. Today I had one of the first ones we did from when we went live in September came back for his 1 month post 4th treatment. And he was just ecstatic. And in fact, his uncorrected acuity was better than it was back then. And he had, he had cataracts, and he's like, is it my cataracts or is it dry eye, and we were like, let's treat this dry eye, and then let's see what's left over from the cataract. And his vision was good. It was just wonderful. It's wonderful to see. But like Mike said, not every patient is going to get that, positive, oh my God, this was amazing. There are going to be some cases where you're like, we just don't want you to get any worse, and we're going to try to help you feel better too. So it's sort of learning how to talk to them.
No, it's great. So I think you guys have laid out a compelling case for E-SWIN technology, both on the diagnostic side with Tearcheck and then the treatment solution with IRPL. Anna, Mike, thank you for joining us on Eyes on Dry Eye 2024. It's been a pleasure.
Thank you.
Thank you.